Okay, today we were tasked to do a case study about psychobiological disorders, and I have chosen the topic Generalized Anxiety Disorder. It is normal for everyone to worry. People worry because of foreseeable problems like financially, family problems, and etc. And that is totally normal. But did you know that some people would worry because of unrealistic events, to the extent that they would manifest physical symptoms like restlessness, fatigue, poor concentration, and irritability? In GAD, a person's anxiety is disproportionate to the actual weight of the problem. So it means small things is a big deal for them. And it is the most common and most extensive anxiety disorder in its class. It affects approximately 3% of the general population each year and is more common in women than in men. That's according to Statistics Canada 2015. Contributing factors: genetics. White Americans are more at risk of developing generalized anxiety disorder. History of significant life changes like a loss of close family members, childhood trauma or negative experiences. Back home, there's a lot of child being a victim of harassment and other sort of crimes. Recent traumatic or negative event, that's also a loss or a loss of close relative members, an accident, a victim of crime, rape, etc. Present chronic illness, people having cancers, heart disease, diabetes, other mental health disorders, depression, major anxiety, schizophrenia, and also ethnicity, especially in Canada, where indigenous people, they are also a victim of intergenerational trauma, so they carry the burden from the past until now. So those are the contributing factors. Now let's move on to anatomy of the brain. Brain is probably the most busiest organ in our body, as you can see here, the function of the brain. There's a lot of function of the brain here. It regulates blood pressure, heart rate, respiration, digestion, initiate regular basic human drives like sex, hunger, thirst, sleep cycle, almost everything. All function of the body starts from the brain. So yeah, it's all in here, the mood and emotions, everything. So our brain is composed of three major parts, which is the cerebrum, cerebellum, and the brainstem. And it also has an effect like sympathetic and parasympathetic. Sympathetic is the fight or flight and the adrenal response, and parasympathetic is responsible for rest and digest. I have included here amygdala and hypothalamus because they are the part of the brain that is more affected with generalized anxiety disorder. So let's move on to the anatomy and physiology of generalized anxiety disorder. So let's start with the stress. That's the stressor. That's the that's the stimulus. That's where everything started. Stress, and then stress will be perceived by the brain, and then the brain will notify the amygdala, The amygdala will send distress signal to hypothalamus and process the sensory information. The hypothalamus will now activate the autonomous nervous system, or the fight or flight. This will increase the pulse, increase blood pressure, increase pupil dilation, increase alertness, and also it will activate the amygdala to release GABA, or gamma-aminobutyric acid. And then once the amygdala hypothalamus release all those sorts of neurotransmitter, the body will return to its pre-stress state. Stress will decrease. However, if people have anxiety, amygdala will have a decreased serotonin level and also a decreased GABA. This is only for people who has anxiety or generalized anxiety disorder. And this decrease in serotonin and decreased GABA will result in the physical symptoms like sleep deprivation, worrying, poor coping, restlessness, and jittery. Okay, let's move to patient profile. I have chosen Mr. Mario Kart, age 34, male, white American. He lives in Saskatoon. Mother is ill, sister in the States. He is a software engineer at a company, was laid off during the pandemic, rents an apartment, lives alone. He is diagnosed with generalized anxiety disorder. He has some comorbidities of essential hypertension, insulin resistance and overweight, and also migraine. Here's this little background on our patient. Mr. Carter, 4 years old, was admitted to the unit due to headaches lasting for days, nausea, and vomiting. The patient was also complaining of restlessness, difficulty falling asleep, stating, "I feel like my head is full. I'm thinking about so many things at once and I can't seem to keep up and feel like I can't afford to sleep." So there's our physical symptoms right there. Sleep deprivation. Client expresses concerns of being laid off again and worrying about financial security. Normal people would also worry about financial, but these people, they worry more. He also adds up that he has become more irritated and easily angered and can't seem to concentrate on work and is failing to meet deadlines. He mentions that he worries about the small daily tasks, worried about not waking to alarm, of car breaking down and not getting to work. Client states, "I feel jittery all the time and incredibly anxious. It's debilitating." So let's move to therapeutic communications I used. I said to the patient, "It seems like you are concerned about a lot of things. Can you tell me more about each of these concerns?" This technique that I used here is called encouraging communication. This would help the client to speak up and share their thoughts, feelings, and concerns. Another one is, it appears that you have a lot on your mind right now. Let's focus on what worries you, have in performing daily tasks, and what you would like to do about it. So the technique I used here is leading the discussion and exploring. This technique helps the patient avoid getting overwhelmed by redirecting their focus on one concern at a time. This also helps them learn more about their feelings and thoughts on a certain issue. Let's move on to nursing diagnosis. My priority nursing diagnosis here is self-neglect related to anxiety as evidenced by unkempt appearance. Treatment goal is patient will be able to perform activities of daily living within level of own activity within 1 week after discharge. Nursing intervention is to provide healthy teachings on how to maintain self-care while dealing with anxiety. Evaluation. Patient will be able to acknowledge difficulty maintaining good self-care while dealing with anxiety. And our treatment outcome, Patient was able to demonstrate ability to perform activities of daily living like toothbrushing, washing, and keeping tidy appearance prior to discharge. Number 2, nursing diagnosis priority here is sleep deprivation related to anxiety as evidenced by fatigue and inability to concentrate on a task. My treatment goal here is for the patient will be able to report better rest and sleep pattern. Nursing intervention introduce some relaxation techniques like listening to music, yoga, or reading to help reduce stimulation and promote sleep. Evaluation here is progress toward desired goal. So we would like to see a little improvement here with the sleeping pattern and rest. Treatment outcome: fatigue will be less evident and concentration has improved since admission. Patient was able to sleep and complete a 6 to 8 hours of sleep cycle. It is days prior to discharge. Pharmacological interventions here is alprazolam Xanax, treatment for generalized anxiety disorder, also a management for anxiety associated with depression. Common side effects here is CNS, dizziness, drowsiness, lethargy, confusion, and headache. GI, constipation, diarrhea, nausea, and vomiting. Contraindication: hypersensitivity, cross-sensitivity with other benzodiazepines. Instructions. Here is take alprazolam 0.5 mg per 1 tablet 2 to 3 times a day. And we need to advise the patient to take medication as exactly as instructed. Never skip, and then don't take 2 pills for the missed dose. Avoid activities that requires alertness, like driving after taking the medication. As you can see here, because it has a dizziness and drowsiness effect, so we should avoid activities that requires alertness. Patient also don't consume grapefruit juice and alcohol while on this drug therapy. These substances, grapefruit juice and alcohol, it alters the what do you call this? The concentration of our drug. So community support, mental health and addiction services located in Saskatoon, Canadian Mental Health Association located in Saskatoon, and Family Service Saskatchewan located in Saskatoon. They provide counseling, rehabilitation for people with mental health disorders. That includes anxiety, all types of anxiety. Crisis: during crisis, these are the hotline numbers. You can call Saskatoon Crisis Intervention Services. This is a 24-hour crisis line, and number is 306-933-8234. They also have a mobile crisis service. This is a 24-hour crisis hotline, 211, located in Saskatoon. You can just basically call them if you're in crisis, you don't know what to do, you're worrying too much, you can't sleep, and all sorts of crises. You can phone them, ask them questions, have a counseling 24 hours, 24/7. Here are my references. Okay, I think that's it for my topic, Generalized Anxiety Disorder. I hope you guys will learn something about it, and thank you for this opportunity to exercise my learning, to exercise what I have learned on this course. Thank you.